Each morning I come in, I try to give you a little topic, talk about a little things in life that may occur that have to do with our balance, whether it be COPD, maybe we have the SAFE Act that's being reintroduced in Congress that's going to allow therapists and physicians to do balance assessments in your annual Medicare assessments, which is a good thing. So hopefully we can get that through. So little things like that is what we'll touch on, just so you guys are aware. This morning, we're going to talk about, can't stand that paper blowing all over the place. It's going to drive me nuts. You kidding? So this morning we're talking about knee replacements, right? We're talking about arthroplasty, specifically the knees. And there's some interesting research. When you think about knee replacements, no one wants to do it. Most people don't want to do it. But if you're active, you guys young, now 70 is young nowadays, right? And I love to say that. But 70 is young, and if you're active and you're having a hard time moving around because of knee pain, then a knee replacement may be a good option for you. I know guys that are playing tennis in their 90s. I don't know what that looks like, but they tell me they're playing. So, and I think that's fantastic. I think that's wonderful. But as far as the research goes, there is an elevated risk before and after knee replacement, that surgery, when it comes to unintended falls. And so what you're looking at is patients waiting for or recovering from that knee replacement are at a significant risk. Pre-surgery fall is a major red flag. Patients who fell within 3 months before surgery had a 2.5 times greater odds of being discharged to skilled care. Now think about that. If you're within 3 months of your knee replacement, of your surgery, what this research is telling us is that if you fall within 3 months, you're 2.5 times more likely to be discharged to a skilled nurse facility. Now, you got to learn to read between the lines there. What else is going on besides the knee? Are we dealing with frailty? Are we dealing with malnutrition? Is there some sarcopenia taking place? Muscles that atrophied? So there's a lot of other factors there besides the knee pain, but this is what the research tells us. And after a hip replacement, there's a 1.8 times greater odds of being admitted to a hospital after surgery. So these are some stark numbers, but nonetheless, the best thing we can do is get into a fall prevention class such as this. And ironically, Tai Chi, which is great, but balance-specific exercises like what we do in here are 21% more likely to help prevent falls than just Tai Chi. Now, I'm a huge fan of Tai Chi. If you have access to Tai Chi, please do it. Okay? So let's not get confused. I'm not putting Tai Chi down in any way. But what we do in here with these balance-specific movements are going to help keep you strong, mobile, and independent for the rest of your life, all right? And if you need a knee replacement, go get it, all right? It's almost outpatient surgery now, outpatient surgery. You can hear the caffeine, can't you? Well, I'm telling you, my brain is running right now, all right? With that, guys, let's stand. Let's go behind our chairs. We're going to take some balance assessments.